Historically, we didn't have good options for retaining a denture or retaining a set of teeth when we were missing all of our teeth. The vast majority of people have difficulty keeping it in place. They're not able to eat the things that they want, or it comes out at inopportune times. Dental implants are a great option, whether that's 2 or 3 or 4 implants and the denture snaps in and out and now it's stabilized but it could still be removed to be cleansed, or whether it's something like the all-on-4 where we place 4 implants and now a bridge of teeth or something like dentures are screwed into the implants so that they don't come out. And so those are great options that are available to patients, so they don't have to suffer through a denture. While there are some people that can adapt to dentures and do tolerate them well, the majority of patients do suffer some ill consequences from them, whether or not it is inability to taste food from the roof of their mouth being covered by the upper denture, or the denture moving around while they eat, or the denture coming out in inopportune times, or loss of bone from the pressure that the denture places on the bone. So most or all of those negative things are addressed and fixed by placing implants into the upper or lower jaw and now using that to help stabilize or retain a bridge of teeth.